Every time I was stuck, I would reach out to some people who have been kind enough to guide me through this journey. And they're like, yeah, this is what you do. Like, this is right. Like, even that comfort that you'll get there, or that's fine, try this. Like, those were things that really helped me find my space.
This is Dr. Meenal, and welcome to Uncover Your Eyes, where we uncover reality. As a mom and eye doctor, I want to know it all. Being a healthcare provider and having been home more with my children the last 8 years has been difficult. Coming back into the profession, being more active, I have felt unseen, unheard, and discounted on so many levels. And I'm sure many other female healthcare providers can probably relate to this. So today's episode, I am very excited to have on a fellow podcaster, Dr. Ukti Vora, who is an optometrist with an MBA, and she is the marketing product manager at TopCon Healthcare, who specializes in software solutions for North America, and she is the podcast host of Nerdy Optometrist. And we are bringing today's episode together to you. So let's do this. So yeah, I'm so excited to do this with you today, Ukti.
Thank you so much for this idea and opportunity. I think this is super fun. And this is also like my first experience, I would say, collaborating in this fashion. So I'm so glad we're doing this together.
Me too. Thank you.
I know this was your idea, but I'm going to start with my first question that I have for
Okay.
you. Is like, because we have known that there is a discrepancy about like the male and female ratio within our industry, and I think it
Right.
would be nice to understand from your perspective, being a female practitioner out there, how do you feel about healthcare being dominated by male practitioners versus female? I know optometry is slightly different, but in
Yeah.
general, when we talk about healthcare.
Yeah. Yeah, absolutely. I mean, I think yes, we're definitely there's a shift. There's always been that gap, and that gap is slowly closing. There was a trend in the US in 2022 that showed that 37% of physicians that were practicing are female now, which is good. In general healthcare, whether you're looking at massage therapists, you're looking at optometrists, nurses, all professions, we definitely see more females in healthcare. But in terms of physicians and doctors, we see more men than women. In terms of healthcare positions, like administrative roles, as you go higher and higher up, you will see more men in those positions than women. So they're assuming higher healthcare position administrative roles than women. But also, you will see in certain surgical specialties or certain specialties like radiology, more men are still there. But I think the most important part of this is as we get into medical schools and start seeing, we are seeing that gap closing. And so the future of healthcare will be more equal, I think, in terms of men and women. But also, even yourself, and me, we see even in optometry, back in the day, there was not a lot of female educators. And now we're seeing in healthcare, female educators, speakers, podcasters, like everything. And we are really working to close that gap. So it might be more healthcare domination with men right now, but we are effectively closing that gap. I think your struggle was a little bit different though, right? You had come from India, and
Mhm.
you were an optometrist. You'd come from India, and I know you did your MBA here and you broke barriers. So tell me about that struggle as a female, right? Like, you broke a lot of barriers getting your MBA and all of that in as an optometrist. So how did that pan out?
I think I was blessed with meeting right people at the right time. Of course, the struggle was real. I was at a point where I felt like, oh God, I'm good for nothing. Because basically, when you're practicing in India as an optometrist, you come to US and you have to restart your career. It's not that you can, translate your degree and you can start practicing, or you can just give an exam and you're done. It's like you go back to school and do all the thing again. So it's little heartbreaking at times. Like, I wish I could, translate some of my credits and start it where I left. That wasn't the case. So yes, definitely the struggle was real initially to try and find out where you fit in this new culture, not just like career wise, but even culturally. It's very different when it comes to being in a new country, specifically after getting married, right? So you're like trying to kind of find your space in all the aspects. But I think the good thing about this whole experience was I explored areas which I would have otherwise not done. So I feel if I would have been practicing OD here or being an optometrist, it would have been great, but I would have never done MBA. I would have never thought of the business aspect of it. And something that I really enjoy and love. I always did manage some part of like business back in India with the practices that I worked with, but I never thought that could be the center of my career. And I feel that's interesting that these changes or the shift where you're uncomfortable, you're challenged, and then you're like, okay, let me find what's the best opportunity for me, what I enjoy. And I did meet and talk to a lot of people within the industry who really helped me navigate through this unknown spaces, I would say. So doing MBA was something like, okay, I think I'm good with this, let me give it a shot while I wait to figure things out. And glad I did, because that introduced me to so many different things of business. That basically where I am today is because of my MBA degree. And the fact it is different, but it's always new, otherwise you're always comfortable and you would have probably been there. So that has been like my journey of trying to find my space and whatever is available. I was kind of looking at different opportunities, and people were really kind enough to guide me when I had like no idea what I was working on.
Yeah, I love that. Like, because you really broke barriers, right? As a female, I mean, most of us, after getting married too, kind of break down coming here. We can't, you kind of lose your degree and all of that. You can't get, reinstated here. And it's just really sad. And you broke barriers by overcoming that and becoming one of the, most well respected people in our profession. And, that's such an inspiration. So I'm really happy for that.
And I have to give a huge shout out to several, just because like I'm also a huge female advocate here. There were
Yeah.
several female optometrists who I reached out to, and they helped me navigate this space so much that I like every time I would kind of get stuck. Also, I'm more comfortable, like I'm sure you would to be as well. Like you're more comfortable sharing the challenges with other female practitioners, like because you can relate to things. So every time I was stuck, I would reach out to some people who have been kind enough to guide me through this journey, and they're like, yeah, this is what you do, like this is right, like even that comfort that you'll get there, or that's fine, try this, like those were things that really helped me find my space and try to do something different other than probably like practicing OD would have been great, but this is something that I truly enjoy. And that's also the beauty of optometry or the eye care industry, where you can do so much. You can be a practicing OD, you can be on social media, you can be in industry. So it allows you to shift easily, as well as it's like fun that you can do it all.
Yeah. But that's the shift. Like that's the mindset shift. Exactly what you said is women empowering women, right?
Yes.
We didn't have that back in the day, right? Like I feel turn back 10 years, there was no female colleagues helping me, but now I feel, women are more at the forefront and supportive of each other. And that's what we needed because the rest of the world didn't understand. So it was, I love to hear that because that is a positive shift in all
Yeah.
of healthcare, I think.
So you tell me about your struggles, because like talking about struggles in the shift, I know most of our struggles that I've realized are very similar, but I
Yeah.
think it's hard to kind of highlight and talk about your struggles. So how did you like what were your moving parts in like moving in healthcare and finding your space being women in the healthcare industry?
I think for me, my struggle, my main struggle was, and I don't know if it was, race, gender, appearance, like it could be anything. Um, the way I walked, like I don't know what it was, but I did always feel like discounted or unheard. And I will always equate it to being female, let alone South Asian. But I think female was a big thing. That I probably will have a family or I have a family or I'm probably at home more, have to pick up my kids or like whatever the situation is. I think we are assumed to not be worthy, even if we have the abilities to be, amazing or the best person for the job. I was turned down in so many healthcare roles. even more administrative roles as an optometrist, purely because of those reasons. I feel, even if I was a better suited candidate. And I think I started devaluing myself, and that was a big struggle that I faced. Was I started feeling I'm not worthy because they're telling me I'm not worthy by that,
Yeah.
right? And to overcome that and believe in yourself, and that was the biggest struggle I faced. And recently it was funny because it's still happening nowadays. A company had reached out to me for a position, like a temporary project, basically, and said to me, we want you to do this project. And I said, yeah, of course. And I asked about the compensation. And they said, well, we don't compensate for it. We've never been asked that before. And I, for a fact, know that there are people who are compensated for it. And so I don't know why this came out of my mouth, but I said, if I was male, would you have asked me that? And they did not have a response. And they basically said, we'll get back to you and we'll think about it. And I never heard from them again. But, I think the struggles I faced, now I feel we need to ask these questions. And if we are going to accept not being paid, like our counterparts, and not doing things, then what's going to happen to us, right? So we need to raise our voices. And if it means we're not going to get that job or that project, because we're not paid, that's good. The industry will start seeing and start changing in order to pay us females, for the same job that men are doing. And I think, it is our time and energy, right? So I think those
Yeah.
are the struggles I faced, and I feel I'm overcoming it with believing in myself and my abilities more and more. But it took me a long time, right? So that didn't happen overnight. It took me, many, many years. And now look at us, we're podcasting, right? So,
Yes.
I mean, that's amazing. How did you get into podcasting? Curious.
So that's again the story that goes back to the fact that when I moved to United States, I was trying to be like give something back to the country where I came from, which gave me my identity, my career, and I was feeling a little bit of, I wouldn't say guilt, but I was feeling like, oh, I've learned everything, I did everything there, and now I've moved away, and I want to contribute back some to Indian optometry, who brought me where I am. And that's where I was introduced with the concept of podcasting by another female podcaster. So, Dr. Maria Sempalis, who probably everybody knows within the industry, introduced me to podcasting, and she had questions about like optometry in India. And I was like, oh, there's only so much known about optometry in India, and optometrists from India are settled like across the globe, and they are doing phenomenal job. And I thought that is a great story for me to kind of bring it and share people who are probably navigating their spaces and trying to go through the same struggles like how I did, right? Like I moved to US and I was lucky enough to find right people. Maybe everybody doesn't get that. So
Right.
that's all the idea of like being introduced to the world of podcasting. I had absolutely no idea how to do it, what to do it, and like where to even start. I was like lost, but luckily I'm married to an engineer who helped me figure things out. So perks of perks of marrying to an engineer. And he's like, yeah, let's do it. If you want to try it, like just go for it. I wasn't sure I would survive almost 5 years now. I just did it as a fun project and see like where it goes. But I'm enjoying every bit of it. So that's how the podcasting started. It started off by talking about journeys of people moving from India and settling abroad and identifying their journeys which are not googled easily. Like I don't want to talk about things that you can google of like what is the application process. I wanted to talk about like what were your challenges in the applications process, what are the scholarships, how did you get through that, how did you choose a different career path, and why did you choose say UK versus US, like questions like those. And that was very interesting, and that's how it all started, and it's still here.
Yeah, I love that. Congratulations. I didn't realize it's been so long because, I just
Yes.
started. So
But tell me, why did you start podcasting? Like it's a great question for you as well.
yeah, I think, well, I love talking, as you can see. So talking has always been my thing since I was young. Um, and I think it was a struggle I faced. I wanted to speak about so many topics. I mean, I think the first one I wanted to bring to the forefront was mental health in our industry, because I feel optometry specifically, but a lot of healthcare professionals, we don't talk about mental health. It's almost taboo or a stigma. Like, you should just be fine. You're an optometrist. You have your own lifestyle. You should just be fine. So mental health was a big topic that I had pitched to many companies to bring to the forefront, especially in optometry, and a lot of them shied away from that topic. And um, that was actually my trigger to start podcasting. I wanted to bring to the forefront topics that are untalked about, unseen, unheard of us, that we're all facing. But I also wanted to bring healthcare together, right? My podcast is more for all healthcare professionals, bring light on issues systemic issues, eye care issues that we all face and that we all discuss, right? For example, as an optometrist, there are patients that come to us and talk about, their arthritis, right? We're not rheumatologists, but these are topics that we should be informed about and
Yeah.
know the basics in healthcare. So that was kind of I wanted to have collaborative healthcare, and this was kind of my only platform to talk as much as I wanted about everything I wanted to talk about. So, I just started, as you know, a couple months ago, and I'm grateful for it. I don't have an engineer husband, so had to figure it all out, like literally from Googling which microphone should you buy, right? Ended up with this one, but I had to Google everything. I had no idea. I had never heard a podcast, actually. So I'm not someone that I don't want to say this out loud, but I'm not someone who reads books. I don't listen to audiobooks. I watch TV, but I had never heard a podcast. I like music. So, in the car, I'm listening to music. And for me to have never heard a podcast, but say confidently, I'm starting my own podcast, was huge. But yeah, that's how it started. But it involves technology. I mean, I didn't know anything, like even what platform to start on. Like, I had no idea. So I know you said your husband, but you are the technology guru, I want to say, especially in our field. So, like you always say, that the present and the future is technology, right?
Yeah, absolutely.
So tell me about that in healthcare, in optometry. Why is that the case? And is that true?
Oh, absolutely. And yeah, I'm glad that I could kind of represent myself that I'm a technology guru. I wish my husband believed in that. But having said that, yes, I definitely do all my editing and posting and everything. So he helped me with the setup, but I kind of learned it on the go as well. Talking about technology, I feel it's such an integral part of our life every day, whether it is healthcare, non-healthcare. Like, I don't think so we can survive without technology. Even like right now, right, we're miles apart, but we can do so much using a technology. And I would say again, this was another beautiful accident, I would say, while during my early days, while I was struggling to find my space in this country, I was introduced with this concept of telehealth. And I thought that this really does not exist. Like, how can you remotely examine anyone, or how can that remote eye care work? And I thought it was all fake. It's just a good experiment. I thought it is an experiment. I didn't even knew that that was a real thing. And this was pre-COVID. It was in 2019. So I met with the company, and they're like, "Yeah, we're doing telehealth. We need an operational clinical manager to manage things." And I'm like, "I'll do a 3 month project. I'll see where this goes. Otherwise, I'll see you probably never." That's how I got introduced to the world of telehealth, or like technology in eye care. And I was amazed with the level of technology that is out there, but it definitely was not adopted back then. Pre-COVID, I was any meeting that I would go to, they're like, "Let's not talk about telehealth. Like, you're doing something." I don't know. It sounded like I was doing something illegal, and I'm like, "No, this is a legit company with the devices that you use." It literally used the devices that were in office. It just had a digital component of it. And everybody was like shying away from that topic altogether. COVID hits, and then suddenly it's like everybody's talking about telehealth. And I'm like, these guys didn't talk about it like yesterday when I met them, and everybody has become like a tech guru. But it
Yeah.
helped me a lot. I would say that because I had a head start, not knowing what I was getting into, but I just felt it was very interesting to see what technology can do. Uh, just a fun fact, I actually was in India while I was seeing patients in New York. So because I was supporting some clinical staff, and they're like, "Can you help us?" I'm like, "Sure." And I was on a vacation back home in India, but I could see patients from there, and I'm like, this is amazing. Like, this is what is the future. And COVID really helped in a positive way to bring in technology within the industry. And now I'm glad it also pushed all the big players to invest in technology, because I felt like we are like decades behind in terms of technology where we should be compared to other healthcare stream. Like if we talk about, say, radiology, for example, as you've mentioned, like they are far ahead of us in terms of adopting technology. Even dentistry, they have like cool technologies out there. We're getting in, and I feel there is no better time to kind of adopt technology than doing it right now. And there are so many things out there, not just in the telehealth space, but even like AI, or you talk about, even in like managing your data and getting information from data. So there is so much that we probably didn't know we can do with technology. So yeah, that's how I kind of bumped
Wow,
into
amazing,
optometry and
amazing.
telehealth. I trust me. I just thought it's going to be a 3 months project. 5 years later, I'm going to be here for another 10. I know that. I love technology.
That's so funny.
But tell me about you. Did you have any experience with telehealth, or like, do you practice telehealth in your practice?
Yeah, you know what? I think I'm exactly what you said. You know, pre-COVID, it was like I'm doing something illegal. I would never do this. And then COVID forced us to do that, right?
Yes.
I don't think I have all the technology to do, telehealth perfectly. You've motivated me to do that, but during COVID, we had to use a lot of telehealth options to take care of our patients, especially those with emergencies, because we were shut down for a few months.
Yeah.
But you were right, like it's a mindset shift. And I think over the last, month or two, and talking to you before, I think it's something that we just need to see and shift towards, because right now, when we don't know about the technology, we almost feel like we're doing something illegal because we're not touching the patient, we're not in contact with the patient, we're not
Yeah.
seeing the patient, face to face. So but if you look at it, a lot of our tests, like you're saying, radiologists, even, right, or certain professions, like a lot of it is online scans, online pictures, online tests, right? So, you know, I can see that happening and being the future of a lot of eye care, healthcare, period. So it's just a mindset shift that needs to settle with me and others, I think. But I'm very excited for it, because the fact that I can go on vacation, or not vacation, sit at home and see my patients in my pajamas would be great. I think it's exciting, and it gives us that, as healthcare providers, that leeway to have a better lifestyle.
Hmm.
And for our patients, it gives them better accessibility, right?
Yeah.
They can access us easier and in off times as well. So I think that's great. But there's a whole other piece to technology, I want to say. Again, I'm not the expert in technology, you are, but the AI piece. So
Yeah.
tell me, like, about AI, and can that be incorporated in healthcare? Is it being incorporated? I mean, you probably know what's being tested, what's being done. So is it in healthcare, and what do you feel about
Yes, I'm going to start with like one word answer. Yes, it has been incorporated in healthcare,
it?
uh, in different aspects, right? So there are, when we talk about AI, AI is like a huge, huge concept, which could be as simple as using ChatGPT to write an email or creating an email template for your patient's response, right? So it doesn't have to be like AI just for diagnostic purposes. It could be using AI in your day-to-day office practice to just be more efficient. It could be like, how are you managing your data? Is AI supporting you to analyze the scripts and help you, document things? Like one of the biggest fatigue in healthcare is documenting the same thing again and again and again. Like, there could be situations where you're just like spending hours documenting after, you've seen a patient. If I can give you 5 minutes back from every patient, you probably will have an hour and a half saved. And that's what AI can do. Like, they can write scripts for you, they can kind of hear what you're saying, they can take notes for you, and they can help you fill up those, like, patient charts. You definitely have to review it. It's not can it, it cannot survive or work on its own, but you can actually save time there. So when I think of AI as a technology and where it stands as of today, of course it's growing and it would probably be changing every minute that we're talking about it. Is I look at it as an assistant which we need but we never had. So don't think of it as something which is going to take your job away. If you're someone who is just doing nothing yet can replace your diagnostic skills or your knowledge or like your expertise. We are definitely not there yet, but can it help you with a second opinion in cases where you're at fence? Yes. Can it help you like take away your work which is like just documenting and spending hours working on charts? Yes. Can it help you with like pre-screening at say maybe a primary care practitioner's stage, where they can do a pre-screening using AI and a retinal image and help you prioritize the patient? If say for example in diabetic retinopathy, because there's so much done in that space already, if a patient say is more than moderate, are showing changes for diabetic retinopathy, then you know you want to prioritize that patient. If that patient is not showing any signs of diabetic retinopathy yet, you still would want to see them for an eye exam, but you can kind of manage your chair time and your schedule accordingly. So these are the small changes that can be incorporated today that can help you be more efficient, be more effective with your time and your knowledge, and spend time what really matters instead of doing all the chores which probably none of us enjoy. And the other big thing about AI which I am really excited about is the way it kind of helps make sense of the data. Like, I know we spend years of research, and the with algorithms and with AI, it can be done at probably like 10x or maybe even 50x speed, which otherwise we cannot do it humanly possible. So using these technology to make more sense, to be more effective in a treatment with patients, I definitely see like a lot of scope where AI can help you not just about eye care, but it can talk about healthcare. It can predict futures. It can predict like risk factors and help you more on the preventative care versus being like more, taking care of the patient after the diagnosis. So I think
Right.
preventative care is a huge aspect which healthcare in general is moving towards, and AI is definitely going to be a critical part of it.
And I think AI, like you said, we see these posts from doctors and things where AI is scary and all of that. But I think it's a mindset shift that needs to happen more positively, where,
Yeah.
like you said, it's cutting down our chair time. It's helping us, make those templates or make those referral letters. Expediting certain patients, flashes and floaters, if they have the detachment, it's able to do those things for us. So it is helping us with chair time, preventative health care. There's so many benefits. So using AI positively. I think so far in other spaces, we've seen AI used sometimes negatively. And so
Yeah.
that's kind of just like telehealth. Some people think of it as negative, but I think it's a mindset shift of how we're using it in healthcare and in our professions. So, I'm very thankful that I met you and you helped switch my mindset, about that. But that is the future of healthcare, and I want optometry and other healthcare providers to really move forward in that, because for us in Canada, I think it will really speeds things up, as well as you in the US. But in Canada, I feel healthcare is not as accessible or as fast, and I think these are things that will make it more accessible to everyone and faster for everyone. Healthcare providers will also have a better lifestyle and cut down on chair time such that they're spending more time with their family, or other things. So that's huge.
And I think it's very important when we talk about telehealth, AI, or technology in general in healthcare. It is important that we as healthcare providers be actively involved in it because the change is coming. And you cannot kind of stop the giants who are already, taking charge. So it's up to you whether you want to be just someone who has no other choice but to kind of adopt it, or be actively involved and like do it right. Because as you said with AI, it's extremely important to do it right. Otherwise, it definitely has negatives to it which we are not. which we might not like it, but we might probably have to survive with it if that's the way it goes. So being part of like the technology, being part of the policies, being part of the adoption, I think all of this matters so that we can implement technology in healthcare in the right manner versus just, okay, this is what is left with me, let me just do it.
Yeah, yeah. No, that's great. I mean, this was fun. um,
This is
I mean, I always enjoy talking to you, and it's so nice to learn from a different perspective, right? Because I'm more clinically practicing, and you're more business, future of eye care. So it's so nice to see what we can learn from each other. So I hope people follow and listen to both of our podcasts, the Nerdy Optometrist and Uncover Your Eyes. But this is great. Thanks, Ukti.
Yeah, thank you so much for reaching out and putting this together. I'm sure with both a busy schedule, it could have been a challenge, but I really enjoyed it. So thanks for this opportunity.
Thank you, listeners and viewers, for tuning in. If you want to catch more episodes of Uncover Your Eyes, make sure to follow or subscribe on your favorite podcast platform and on YouTube. To learn more about me, follow me on Instagram at Dr. Meenal Agarwal. Until next time, keep those eyes uncovered.